thuốc lá thì chắc nằm ấy nó mới chỉ là nằm 80. Khi 80 là tôi được điều về cái đồn ma lục thang của tôi, thì báo cáo bên cạnh thì chỉ là cái vấn đề mà bệnh này tôi cũng phát hiện được lâu. Người ta cứ bảo là bố nó bị thế nên nó di truyền. Đấy, vì ông bố tôi là cũng bị bệnh ho thở, khả năng đấy thì cũng từ từ. Đấy, không suy nghĩ.
Many years later, Zol van Mijn's illness was finally diagnosed as smoking-related chronic obstructive pulmonary disease, better known as COPD. By 2018, his breathlessness sometimes got so bad that he ended up in hospital almost every month.
Tobacco smoking is the leading cause of chronic lung disease in Vietnam. Almost a half of the male population smoke. In addition to that, in many of the large cities, air pollution is a significant risk factor, as well as other environmental triggers for conditions such as asthma.
The Respiratory Centre at Bach Mai Hospital manages Vietnam's response to COPD and asthma. The centre's director says that people with chronic lung disease are often diagnosed late. And when they are diagnosed, it's often hard for them to access ongoing care to help them manage their condition.
Cũng đã có 106 các phòng khám quản lý bệnh phổi tắc nghẽn mãn tính và hen phế quản ở tuyến tỉnh và có khoảng 135 các phòng quản lý bệnh phổi tắc nghẽn mãn tính ở tuyến huyện. Tuy nhiên với cái việc mà xây dựng mạng lưới như vậy thì cũng cải thiện được một phần về cái chẩn đoán và điều trị bệnh phổi tắc nghẽn mãn tính. Nhưng mà trên thực tế thì vẫn còn rất nhiều những cái tồn tại.
For the primary care setting, it is really difficult for the healthcare worker over there. We haven't got enough medication for asthma and COPD patients. We don't have rehabilitation program for COPD and asthma patients at primary care setting. How can we solve this problem?
Since 2017, leading professionals in respiratory diseases and public health from both Vietnam and Australia have been working to find an answer to this question. This is through an initiative called the Vcaps study. This groundbreaking study involves 40 district hospitals across the country, including the one where Zol van Mijn joined the study in 2021. Through the study, he takes regular tests to monitor his condition. He is prescribed inhaled medication at no cost and is supported with medical advice. Zol van Mijn says that he is relieved to have people to help him manage his symptoms.
Thế thì cho thế thì mai hít tôi bảo ôi hít cái này đỡ quá. Đấy. Thế là sang năm nó chỉ có 2 lần. Đấy.
Thế thì cũng rất là may mắn là cũng được ở bên Vcaps cũng là hỗ trợ về mặt về phía kiến thức để mình chuẩn đoán điều trị bệnh nhân rất là tốt hơn. Và
apart from trialling better preventative care, Vcaps is also exploring how to actually help people to stop smoking. Across Vietnam, cigarettes are cheap and part of everyday life. Changing this situation would be the most cost-effective way of reducing the burden of lung disease in Vietnam, says Associate Professor Fox.
We've been looking at the high smoking rates in Vietnam. Why do people smoke? Where do they smoke? And what can we do to reduce smoking rates, particularly among men?
Vcaps is trialling a combination of doctor counselling as well as a quit line with some success. But with smoking so ingrained in Vietnamese society, major challenges remain. People often don't want to get support to quit. Regulations aren't enforced, and smoking amongst healthcare workers themselves is common.
There is an urgent need for more regulation and more control of smoking, and we've also shown that we need to be educating healthcare workers so they can be good role models.
Does anybody smoke? It's okay, but if you do, you should join our quit line.
After 5 years, the results of the Vcaps study will be released in early 2023. Initial findings show that the preventative treatment being undertaken by people like Zol van Mijn is well tolerated and that doctors at primary healthcare facilities appreciate having access to better tools and medicines. But one big question remains.
So far we've shown that within the health facilities that patients and doctors really like the program that we've been implementing. They find the medication to be helpful for them and they take the medication. And we're now looking at the results to see whether after 12 months we've been able to reduce the rate of flare-ups among that population.
For Zovan Mine, this question has already been answered. While there is no cure for COPD, being part of the Vcaps study has shown him that it is possible to manage his symptoms and have a better quality of life.